When all is considered, the truth is Jamaica has done well in terms of managing of the pandemic. I would prefer not to comment on what an institution in another jurisdiction classifies as levels of risk. I've seen these pronouncements made when we have had a different experience on the ground here. But the truth is they have a responsibility to their citizens, and I don't think one should second guess what their view is and how they choose to advise their nationals. What I can say about Jamaica is that we have a surge, and that has been made public. The surge is nowhere as dangerous or threatening as previous surges. Hospitalization, while going up, is incremental. Deaths are minimal, as regrettable as each death would be. And yes, there is a spread, but it is, for the most part, mild, and people recover at home. Again, I say that decisions that we take as government is multifaceted. It's around how we balance lives and livelihood. Having gone through 2 years plus of COVID, we are now at a stage where we really need to get our children back into school. We need to get people back to work. We need to get our senior citizens to go walk around the park again, because the side effects of them not doing that in the past 2 years has created the very problem that we're now facing here, to get antisocial behavior less frequent and get everybody back to normality. So it's really about how we balance the risks, and that's what we have been doing. We've been balancing the risk. So I think it's important that Jamaicans are concerned about the surge. I think it's important that Jamaicans take the necessary precaution to protect themselves and to assess their risk. And I don't want to devalue that conversation, but at the same time, I think we are also focusing on how we restore some sense of normality, because that is also a healthy thing for the society. The CDC has a perspective. I mean, they have had their own issues in terms of surges in their country, and we facilitate, the media does, the information as to what's happening there. But it's their view, and we just have to provide our Jamaicans with the information so that they can make their informed decision. I know we have our fair share of critics, and in a democracy that is allowed. We have no issues at all with that. But when all is considered, the truth is Jamaica has done well in terms of managing of the pandemic, and I probably not the one to say it, given that I have been at the forefront of it. But if you look at lives saved as opposed to lives lost, if you look at the hospitals adjusting, pivoting to facilitate and provide care to those who need it most, if you look at the messaging, if you look at the community engagement by the primary healthcare system, the nurses, visiting homes, the community health aides, if you look at vaccination, which is more than available, even though the take-up has been low, on all counts, I think there is no Jamaican who is not aware that COVID exists, that it is a risk, that what they must do in terms of the social distancing, mask wearing, and sanitizing, and if they need a vaccine, or the vaccine is there for them. What more can we do? There's always room for improvement. I've never been one to say we're perfect, or certainly I'm not. And so it's really about how we pivot and learn from the mistakes, build on it, and provide better opportunities going forward.
Minister, the foot and mouth disease, are we on top of it, and what's your advice to parents?
Every year we have a few cases of foot and mouth disease, and what is important is that it is discovered early and that we respond to it. And I think that in this instance we have had an outbreak in one institution, and the authorities have taken the right decision. The public health parish level are always ready to go in to assess, to recommend response, to clean up, and sometimes it involves suspending the classes coming together because of the contagious nature of it, and until we sanitize. And I think that is happening. I don't think we should be overly alarmed about it. I think the good thing is that we have a system that works. When it happens, we deal with it. And you know, when you have children, when you have an environment where people are interacting and sometimes not so concerned about the touching and the contact and so on, you're gonna always have this kind of thing happen. The key is to cauterize it and to stamp it out as soon as it comes, and I think that's what has happened.